Hello everyone, Dr. Sagar Bhattad here, Paediatric Immunologist, Aster CMI, Bangalore. Now this is regarding Arman, a child. When I first saw him, I would say 6 or 7 years back, when he was 18 months old. He had been recently ventilated at Hyderabad for severe pneumonia, and once he recovered out of that pneumonia, a pediatrician from Raichur called me up and said, this child has just come out of a very severe illness, but I think something is wrong with this child, and this child was referred to us. We performed a test called the DHR test, which is an immunological test, and confirmed the diagnosis. You know what this child have? This is chronic granulomatous disease, a serious immune problem. We offered bone marrow transplant, but because of social situations and financial challenges, immediate transplant was not possible. This child went on to develop very severe fungal pneumonia, requiring antifungal treatment for months before we could initiate a bone marrow transplant. His sister was tested. And why is that important? Because these are genetic conditions. So we made sure that the sister who was supposed to be the donor did not have the same problem. And then once CGD was excluded in the sister, she was chosen to be the donor, and a BMT was performed last year. Now this boy is doing well. The message here is very clear, that stabilizing the child, treating serious infections before we perform BMT, and screening the donors, especially family members, to make sure that they don't have the same genetic condition is very important to achieve a successful transplant. Thank you.
ಸರ್ ನಮಸ್ತೆ. ನಮ್ಮ ಹೆಸರು ಹಾಜಿ ಅಂತ. ನನ್ನ ಮಗ ಅರ್ಮಾನ್ ಮಾಲಿಕ್. ನಮ್ಮದು ರಾಯಚೂರು ಡಿಸ್ಟಿಕ್ಕು. ಅಲ್ಲಿ ಹುಡುಗ 18 ತಿಂಗಳದಾಗ ಇದು ಬೋನ್ ಮೆರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟಿಂದು ಬಗ್ಗೆ ಹಿಂಗೆ ಬ್ಲಡ್ ಟೆಸ್ಟ್ನಾಗ ಗೊತ್ತಾಯಿತು. ಆಮ್ಯಾಗ ಹಿಂಗೆ ಅಲ್ಲಿ ರಾಯಚೂರ್ದಾಗ ಇರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರು ಬೆಂಗಳೂರಿಗೆ ಕಳಿಸಿದ್ರು. ಇಲ್ಲಿ ಡಾಕ್ಟರ್ ಸಾಗರ್ ಭಟ್ಟ ಸರ್ ಅವ್ರಿಗೆ ಬಳಿ ಕಳಿಸಿದ್ರು. ಬಟ್ ಇಲ್ಲಿ ಇರ್ತಕ್ಕಂಥ ಸರ್ ಟೆಸ್ಟಿಂಗ್ನಾಗ ಹಿಂಗೆ ಬೋನ್ ಮೆರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಇದೆ ಅಂತ ಹೇಳಿದರು. ಆಮ್ಯಾಗ ಸರ್ ಅವರು ಡಾಕ್ಟರ್ ಸ್ಟಾಲಿನ್ ಸರ್ ಹತ್ರ ಕಳಿಸಿದ್ರು. ಆಮ್ಯಾಗ ಸರ್ ಅವರು ಬೋನ್ ಮೆರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡಿದರು. ಪರವಾಗಿಲ್ಲ, ತುಂಬ ಇದಾಯಿತು. ನಮ್ಮ ಹುಡುಗ ಬೋನ್ ಮೆರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಆಗಿದ್ದು 9 ತಿಂಗಳದ್ದು ನಡೀಗತ್ತದ. ಬಟ್ ಪರವಾಗಿಲ್ಲ, ಚಲೋ ಟ್ರೀಟ್ಮೆಂಟ್ ನಡೀತಾ ಇದೆ. ಡಾಕ್ಟರ್ ಸ್ಟಾಲಿನ್ ಸರ್ ಅವರು ರಘುರಾಮ್ ಸರ್ ಅಂತ ಇದ್ದಾರೆ. ಪರವಾಗಿಲ್ಲ, ನಮ್ಗೆ ಯಾವ ಥರ ಟ್ರೀಟ್ಮೆಂಟ್, ನಾವು ಮನೆಗೆ ಡಿಸ್ಚಾರ್ಜ್ ಹೋದ್ರೂ ಪರವಾಗಿಲ್ಲ, ನೀವು ಮನೆಯಾಗ ಯಾವ ಥರ ಹುಡುಗರನ್ನ ಇಟ್ಕೋಬೇಕು, ಯಾವ ಥರ ಇಲ್ಲಿ ನೋಡ್ಕೋಬೇಕು, ಏನು ಫುಡ್ಡು ಕೊಡಬೇಕು, ಏನು ಕೊಡಬಾರ್ದು, ಬಟ್ ಯಾವ ಥರ ಸ್ವಲ್ಪ ಒಂಚೂರು ಏನನ್ನ ಆಯ್ತಪ್ಪ ಅಂತಂದ್ರೂ ನಮಗೆ ಕಾಲ್ ಮಾಡಿ ಕೇಸಿ ಡೈರೆಕ್ಟ್ರು ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಬಂದ್ಬಿಡಿ ಅಂತಲೂ ಹೇಳ್ತಿದ್ರು ಸರ್ ಅವರು. ಭಾಳ ಒಳ್ಳೆಯವರು, ಭಾಳ ಒಳ್ಳೆಯಾಗಿ ಟ್ರೀಟ್ಮೆಂಟ್ ನಡೀತಾ ಇದೆ. ಡಾಕ್ಟರ್ ಸ್ಟಾಲಿನ್ ಸರ್ ಅವರು, ರಾಮಪ್ರಕಾಶ್ ಸರ್ ಅವರು ನಮಗೆ ಭಾಳ ಒಳ್ಳೇದು ಮಾಡಿಬಿಟ್ಟಾರೆ ಹಿಂಗೆ ನನ್ನ ಮಗನ ಸಲುವಾಗಿ. ಬಟ್ ಕೇರ್ಫುಲ್ಲಾಗಿ ತೊಗೊಂಡಿದ್ದಾರೆ. ಬಟ್ ಅವರಿಗೆ ನಮ್ಮಲ್ಲಿದ್ದ ಧನ್ಯವಾದಗಳು ಅವರಿಗೆ. ಬೆಂಗಳೂರಲ್ಲಿ ಆಸ್ಟರ್ CMI ಹಾಸ್ಪಿಟಲ್ದಾಗ ಭಾಳ ಸಿಬ್ಬಂದಿಗಳನ್ನೂ ಪರವಾಗಿಲ್ಲ, ಚಲೋ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ತಾ ಅವರು. ಈ ಥರ ಆ ಥರ ಇದು ಮಾಡ್ಕೋಬಾರ್ದು, ಹುಡುಗರನ್ನು ಚಲೋ ಇಟ್ಕೋಬೇಕು ಈ ಥರ ಅಂತ ಕೇಶನು. ಸಿಬ್ಬಂದಿಗಳನ್ನೂ ಪರವಾಗಿಲ್ಲ, ಚಲೋ ನೋಡ್ಕೊಂಡಿದ್ದಾರೆ. ಬಟ್ ಆಸ್ಟರ್ ಹಾಸ್ಪಿಟ್ಲಿಗೂ ಪರವಾಗಿಲ್ಲ, ಚಲೋ ಟ್ರೀಟ್ಮೆಂಟ್ ನಡೀತಾ ಇದೆ.
Hi, I am Dr. Stalin Ramprakash. I am one of the Paediatric Haematologist, Oncologist and Bone Marrow Transplant Physician at Aster CMI Hospital. We are talking about Arman Malik, who is a 7-year-old boy who was diagnosed with chronic granulomatous disease. Actually, he presented at the age of 18 months, where he had multiple infections and went to several hospitals. And by the time he came to us, already half of his lung was destroyed because of repeated infections. And there was also evidence of fungal infection, which we were trying to clear with a lot of antifungal medications. But still it was not completely going away. So we had to take him for transplant in spite of with the fungal infection, because that is only his chance. So we took him. Luckily, his sister was a full match. So we went ahead with the match sibling transplant. And now he is almost 8 months post-transplant. He's doing very well. The pre-existing lung damage will persist, but at least he's able to do all the normal activities, and over time it may slowly repair itself. We had a 7-year-old boy referred to us because he was suffering multiple infections, and he had been to multiple hospitals in Karnataka as well as to Hyderabad. And then finally, he was referred to Dr. Sagar, who is a pediatric immunologist, who finally diagnosed his medical condition, which is called chronic granulomatous disease. There is a inherited defect where he's not able to fight the infections. So the only curative treatment for that is bone marrow transplant.